abe cancer and the Dr. Bernard Okoe Boye. Doc Akwaba.
Obi.
Dr. Bernard Okoe Boye.
O my ni na nyumbe na otu eno. Enopa ewia misumetu me there. Misumetu one of my favorites.
Your favorite pa. Tuna memwa.
Say we the elder. One na ya obe boy.
94.7.
Ao mikra. Jiratina ye. No non kuna. Osaye yi. Ao mikra. Jiratina ye. Oh non kuna. Osaye. Oh yo batampa. Na yemu ye kesi. Ono na wama yenya nkwaji.
Oh. Mobro fueja. Obiara ni wa otisenu. Ono kuna. Osaye.
Misi oyo batampa.
Na yemu ye kesi.
Ono na wama yenya nkwaji ana.
Ono na wama yenya nkwaji. Mobro fueja. Obiara ni wa otise ono. Ono kuna.
Asempa FM 94.7.
That's a powerful song.
The song is my favorite because your uncle for Bebre are more film. And if you check yourself and them, only say you are not more qualified than them to be alive. And as for me, because of where I'm coming from, where I am, I know God has done enough.
Yeah.
Even if He decides not to do any other thing.
Yeah.
Where I am is
Why
enough.
be?
Why be? So I'm always grateful. Now, in this world, if one kai uhu nemapa nyami ayamawa,
Yes.
one shall you be forever ungrateful. At a point in time, Israelites, you know, when so mudi aduane in heaven, Obi,
Yeah.
can you imagine?
Yeah.
Human being, oh, and aduane odino.
It was
A being was
dropping
true,
from
and I
heaven.
several form. Only say even after that, me complaining so my bread, aduane no, my dear aduane bakwache. Even the thought, Obi, the thought say we aduane awodi, Yankupon ne enua, enodima. That alone should tell you that there is nothing He cannot give you.
Yeah.
But nipa is complex, so we have to always remind ourselves of the good things that am I. Enti me baha me di asida nenam asida kwa Obi.
Aseda. The last time Yehu studio, how was the day I read out your appointment letter?
Yeah.
Okay. And ever since we decided say I was say Yama Okwan I will settle in. Na ejuma Ghana for the Asha Wonsano Utimi Ebo Ejuma. I think it's been a little over 100 days since you assumed your new role as CEO of the National Health Insurance Authority.
Yeah.
Over 100 days, maybe.
Absolutely, Ampa.
Wow, 100 days about so soon. Yeah. What settle in, Kama?
Oh, nyame adom meka say unse plane take you offer. Obe unse na money tisu kakra sa afi be dure bi na ya ka say afi de obi atimi e releasing the seat belt. She say e cruising level.
Okay.
She say no nyankopa adom ya do cruising level.
Do cruising level.
Yeah.
Okay. Enti Ghana for bebre na nim NIA. Me say NIA, National Health Insurance Authority. And the authority that manages the National Health Insurance Scheme.
Yes.
Good. And it is here no say you didn't come about the scheme, right?
Yes.
About the scheme. And what would take it over no scheme ni jina hinsi here.
Obi, first of all no, my main first ma ye papa President Akufo-Addo. Say why ye me muka say the favor.
Yeah.
Say what do me Accor health insurance. Me catch madam for baku say nyankopa dom me kita about 5 degrees. Trying to add 2 more. 7 is a perfection number, so at 7.
You know, already 2 count.
Yes, then that will be it.
85 near the end of the day.
Oh,
I'm interested.
I have a BSc
in
human biology.
Human biology.
I have a BSc in medicine and surgery.
Okay.
I have a master's in public health.
Public health, okay.
I have an MBA.
MBA in finance?
Yes, it's a generic.
Generic MBA, okay, MBA.
And then I have
that's number 4.
Professional executive masters in ADR.
ADR, alternative dispute resolution.
Yes, from Game and Game.
Oh, from Game and Game, okay. And I say, my name is LLB.
Yes, LLB. Then the last one is a PhD I'm working on now.
Oh, the PhD, what started?
Yeah, I'm in the 2nd year.
Okay. And you are doing that alongside the LLB?
Yes.
Dr. Okoe Boye.
Obi, with God, all things are
possible. All things are possible, it's true. And all of this
now
at age 38?
No, I'm 40 now.
Oh, what do the 4th floor?
Yeah, now I'm 40.
You've done well.
I mentioned this to let you know, say, there are people with greater capacity and qualification than myself.
Yes.
So I've not been sent to health insurance because of these 5 things.
94.7.
It is the magnanimity of His Excellency. He does as He pleases.
Yeah.
So when He decides to choose you, you have to be forever grateful. And so, Medanasi.
Yes.
Na Mada Munina Amasi, you are my very good friends and supporters. Obi, health insurance, they do basically 3 things.
Okay.
So the Act now established a health insurance. 2003, that was Act 650.
Okay.
But health insurance started in Ghana, President Kufuor Bayano. Now, district Bia or no health insurance. And Obi independent.
Okay.
District Nankasa na setting the tariffs. District na share ska or scanner onyano so. And Obi district na na sebi Eddie hospitals etna CSA agreement. Omo ase vet claims and omutua. So we had more or less 170 different claims processing centers across the country. 170 independent boards. And so the governance structure was Sananeti. And even the mutual. Yes.
Okay.
The mutual schemes, the district mutual schemes. And because of some of the challenges, although it meant well, there were many positives. But one major issue too was that there was no portability. And to work district mutual program, so untimi ukosunyani untimi visit hospital.
Untimi fa card
no hospital. This is a work issue.
Okay.
So the Urban said 2012, and a review, an amendment of the law.
Okay.
And I Act 852.
Okay.
Now, I nationalize the scheme.
And a national health insurance scheme.
With one central headquarters, one board, and all that.
Okay.
So the scheme now, with your card, you can visit any accredited facility.
Okay.
Now, the Act established the scheme which registers Ghanaians and pays for those who are covered by our insurance. The other one is the Act also established a fund, which is the National Health Insurance Fund.
Okay.
South fund muna yetua claims and no muna yedi scan etua administrative expenditure and a bisu na yedi support health at the Ministry of Health.
Okay.
And that's the second one. And the third one is it established the authority, which is a regulatory body. So the authority actually regulates the medical insurance space. And to be running any form of medical insurance or Ghana, no, a health insurance, National Health Insurance Authority
and a regulator
and a manual license.
Oh, sanity.
Yes.
Okay.
Metropolitan, Acacia, nationwide. Obia running Cosmo. I mean, almost financial statements. The law stipulates all the things they have to go through. We give the license, we can revoke it.
Oh, okay.
And National Health Insurance Authority.
Okay.
Now, I am wearing 2 caps. I am the chief executive of the authority, and I'm at the same time the chief executive of the scheme.
And National Health Insurance Scheme.
Yes.
Oh, okay.
So what people interface with all the time is a scheme. So largely 90% of our communication and discussion
is on the scheme.
Yes, on the scheme. Now, Miko Hono, Osha, in terms of active membership, 2015, now about 11.3 million Ghanaians and active on health insurance. 2016, about 10.9 million and active. Now, last year, 2021, now about 16.7 million Ghanaians and active on health insurance. And now, this year, we are doing about 14 million.
14 million.
14 active members. Now, Obi, we can recently say the biggest problem facing this country, which is also a national security problem, is that over the past 15 years or so as a country, at any time, less than 60% of our population and are fully covered by any form of medical insurance. And now, when you step out of your studio, when you meet 100 Ghanaians, 50 of them don't have any form of medical insurance.
Both private
and public. In fact, omo private sono, who are in 700,000 people.
Oh, really?
It's less than 1 million. All the private insurance companies, clients. Now, in this current world, where the only thing you cannot negotiate, being health, if half of the population are not covered by insurance, it's a threat.
Is it the case that half no or module level or yari or no abetimetria ashen ho yari?
So 2 things. 90% of them is ignorance.
Oh, okay.
The 10% omofi somu ska or
metimetria. Okay.
Now Obi, it takes 8 Ghana cedis to have access to medical care in Ghana here for 12 months.
8 cedis?
National health insurance. We charge 8 Ghana.
A year.
The whole year. If
premium near 8 cedis.
If you are a SNIT contributor, you don't pay premium. You pay only processing fee, which is maximum 8 cedis. If you are a first timer. And to share Ghana no insurance, no a SNIT contributor. 8 Ghana when you say Onibi, either say he is ignorant of this social cover, and now sebi he just doesn't care. And now on cross insurance for Ghana. Now, if you are not a SNIT contributor, or you are informal, Obi, it takes maximum 28 Ghana cedis.
28 cedis
for a year.
For the whole year.
For the whole year.
To be on the scheme. 28 cedis.
28 cedis. Now, 2 weeks ago, me call Lekma Hospital. Now, me share Abriwabi consultation. Oba no me catch and say okojini ndro na onfa ni nyina mbekire me. No okita health insurance. Ne card active. Obi or hypertensive. Me hwe no man ndro, BP ndro, ba ku ye AC inhibitor, losartan. Another one ye calcium channel blocker, amlodipine. And I mean man azithromycin because no chest infection. Yeah. Obi okoba the training nyina bekire me. 1 Ghana cedis. Lekma Hospital.
Covered by the
all
scheme.
Covered by the insurance. Now another woman by me room. Oba no me enter ni din wo machine mo no obi na emfa. And I'm say madam, insurance ni ejuma. I say oh, the card ni ejuma. All the card ni che me 2020 to 2023. But a card, fiscal card no. A duration no. But you can only be active after registration renewal for 12 months.
Okay.
So now you're active for 12 months, but the activity no expire last year. I think November 2021. And although the fiscal card can be used just on the core, everything has a renew bill. Yeah. That's why it's still valid. The membership on the scheme, Obi, straight away, Okoe say Okoe G folder bano for not having active health insurance or 20 cedis. Everyone over home in 1 year. Make sure you are half or the scatter they can go to abonti. The point I'm making is that until you get to the hospital, you will not appreciate how real this is. With 28 Ghana cedis or 8 cedis, you get peace of mind for 1 year. So if all it takes is 28 cedis or 8 Ghana, how come half of this country is not on a scheme? No, because them say, oh, doctor say insurance and cover. Me see, be careful. Sometimes sebi politics inti ya kaka sebi. Even when it's not true, ebi mu di ye juma. Obi, o shi obi awo say cover. If you get to the hospital, you don't have the card. That's where you know that. And you be biana edidi agro. Now GH1, no more year program one morning and chair. Lady B, ya detain or reach hospital. Omo ye documentary medical prisoners. It was a documentary. I think TV3 or GH1.
Okay.
But now me sure GH1.
Okay.
You see the bill here 4,000. Now to me 20 ya gina to reach. Discussion no ko said oh Ghana health insurance here say malaria and typhoid. Operation to say appendix in amadi insurance in cover.
Insurance in cover.
Obi. Nyame adom na me friend na me nyom na me say oh. Now Ghana health insurance no sebi fibroid removing the uterus hysterectomy and cry insurance cover.
Oh really?
hysterectomy I me take a doctor 2, 3, 4 hours. Our consultants, you know, insurance cover. How much less appendix? Appendix. Ukita sharp surgery now less than 45 minutes. That operation. And almost you. And I'm catch a documentary and I'm much. Lady no can say the insurance card on head and I expire. You have to take the opportunity to do education. Obi, do you know say uncanny insurance ni ejuma? Sa bill of 4,000. Nina
scheme no befa.
Scheme no betua. National insurance scheme, we pay an average of 110 million Ghana cedis every month
on claims.
On claims. And we Ghana for medical bills so buying no etua as in the scheme etua 110 million. Anka 4,000 we anka beshim.
Yeah.
So immediately I make a chomono. Luckily for me, and one of the panel members say, "Oh, ni mami nya problem. Oh, Winiba. It didn't call Winiba trauma. No money insurance. From consulting room to folder, they paid money." A lot, about 2,000-3,000. A chain will be too move for say, oh, insurance. When they came back some weeks later, BBI man on one to actually. So it is true. And I make a say, almost all surgical emergencies, health insurance cover. To say one year appendix, to say be oba one year topic, nina insurance cover. And Obi, I'll get there. I keep on telling everybody that I will prefer an insurance cover with national insurance scheme, which, although I don't want that to happen, will make someone pay 100 Ghana cedis after visiting a hospital for a procedure, than the one who has no insurance at all, who will be asked to pay 4,000
cedis.
It's unfortunate, so because some facilities, if you know, be 50, 100, 200. But Okoe government hospital now in insurance, will be free on one shot. So the biggest threat to citizens in this country is that we have an insurance scheme that is so cheap and social in nature, yet people have not taken the pains to activate. Now, before I entered your studio, me call star 929 Obi.
Star 929.
Star 929.
Okay.
Now, Udali star 929 now.
Star 929 hash.
Sorry, star 929 hash.
Okay.
So, for me.
Okay.
Ubehu number 1, check policy validity. This is the most important check for every Ghanaian.
Check policy validity.
Me ukoha. Or see, so I'll dial 1. Now I check it.
Yeah.
I see, please select card, NHIS card or Ghana card. Okoe Boye, I have linked my NHIS to my Ghana card.
Your Ghana card.
So I'll go to 2, which is Ghana card. Obi, or see, please enter your Ghana card number.
Okay.
So, make a reply. Now I enter my Ghana card number. Now my Ghana card number no Obi. You are seeing into me body.
That be want me more. Obo ebe hard.
Enti me bowo me phone no so. Na ma bo ewie no. Abisa me for confirmation of the number. Obi. So let me enter. Or see, I should re-enter. So just for confirmation.
Yes.
Enter me number no. It starts with G1H. All right. It's 11.
Obo.
My shadow JB. Oh, my JB was 15. We try Obeka. Now, Obi.
Yes.
My enter. Or see status active.
Active.
Card number wabo. Start date 26th of November 2021. End 25th November 2022.
Oh, okay.
All it cost me was about 7 CDs.
Because we are SNET
Because I'm a SNET contributor. Obi, my wife is covered on health insurance. My 3 kids are all insured. I don't joke with it. Because wisdom will tell you that if you are hungry, someone can give you food. Only a bit da. Omo mu ton sebi. Adi was true so ebi only a bit da no. Nyame wo kwan oma we ni kata obe sorry. But when you get sick, you might leave the earth. Obe free you as. So you don't joke with that one.
Yeah.
Etiobi at health insurance, it's my biggest drive to make sure that every Ghanaian
will be on the scheme.
Will be on the scheme. Now, I am happy to say, whilst I'm pushing this, we at the scheme also, with my leadership, the person sure say, we establish 2 key legacies at health insurance, which I've started working on. As we speak, less than 50% of our claims management, NHIS electronic. Just for the claims breyer.
Claims bar.
Your friendly partner Matt Nancy. omo hwa OBC we or show obi atua no 10 or 10,000 I say we hwa e fatana atua manual obi. Now the history, the theory and the practice has taught us say manual leakages new wastage does.
And I'm for discretion, so
absolutely.
Play.
Within 18 months since I stepped there, we are supposed to go fully electronic in claims management.
Digital,
Obi. When Akufo-Addo became president, now Ghana, from 23 I started insurance up to now 10% electronic. Claims are 10%. We have moved from 10% to about 49.
Okay.
Over a period of about 8 years. Obi. Makase is a challenge for us. Me pese yen kase Okoe Boye by health insurance and manual became a thing of the past.
It is a core electronic no with claims management now. Meaning say hospital na share IRF phone we hospital or service provider or share IRF phone we are now they enter onto a system.
Absolutely. And yedu minimum kasai anaye kasai you started training all hospitals in Ghana are credentialed to use a particular software application.
Okay.
So that now usheni pani we are unfa papers in braille. Say yen show na yen access it. Ube upload all the information on the program, the software.
The software.
So that it is received at our
in real time.
In real time.
Our Momo claims.
Yes.
But nipa no information now they ebe how do you vet it?
Say algorithms are yedi shemu no.
Okay.
Emma ultimi check reduce fraud and wastage. For example, if we enter malaria, Dr. Biometric say malaria treatment lasts 3 days.
Okay.
And the doctor be put in malaria. Now okase wa malaria drug for 2 weeks
a problem.
Ebe error. Maximum charge I was saying 3 days. Obi use manual obetimi dey shame say wa man draw for 7-8 days.
Yeah.
Now obi treat obi for malaria. Now man malaria draw now wakase wa man amoxicillin machine no mfa because the mfa amoxicillin and treat malaria. But say manual one shekra why did the cost of amoxicillin to the tariffs in terms of the claims.
Okay.
And the electronic has a way of weeding out inefficiencies and wastage. Now, your inbuilt checks so I sure say you can audit the system. Let me follow artificial intelligence. Let me follow a trend. Let me pick it way so that we can zero in and do clinical audits.
What that then means is I say a call full hall, call the whole country electronica. So it runs on internet, right?
Absolutely.
It means there was a hospital we are a service provider and you have access to internet.
Working hard to make sure say that 5% of our facilities out of the 100, about 3 to 5%, omu was serious problem with connectivity. Omu can use USS code.
Okay.
USSD.
Okay.
And developing applications they can have simple software application without internet. They can still send out information offline. Where non-negotiable. Your team now we've sat down. I've convinced the entire staff. We are all on board that manual management, claims management, will be a thing of the past. One other interesting legacy, I know the President Akufo-Addo, I charged me said, Doc, this must happen before I exit Jubilee House. From President Akufo time up to now, claims now about 110 million every year. No? We pay
every month.
Every month, no? We pay into the dark.
Into the dark.
Yes.
I see what you're saying.
Obi, across Ghana, you're receiving sometimes close to 1 million claims. As in, for 1 million Marco Hospital annually. What we pay is in the range of about 1.2 billion Ghana cedis. Obi, there is no biometric empirical evidence that just say Obi Eko Lekma Hospital Thursday at 9 a.m. In fact,
you rely solely on information at hospitals.
Absolutely.
Wow.
Now, Obeti Miyako Hospital Monday. Usha feel be a mensa omu. Usha mensa be hospital be a. Obeti Miyako say what by hospital 5 times. So get our records, Obi. Now, majority of our providers, Sebi, they behave themselves well. You're honest. But once you are dealing with human beings, you should know, say, until you put a system
in place.
I bet you say, last month, August in Crawford 1,000 and a call for noche. Obi onto other system. Say for noche di 15,000 claims brewer. Obi you are in the dark. So what we are working towards, we are almost there. Say before the end of the first quarter next year, we can't start the whole country, but we'll start with a number of facilities. Okoe Hospital, client, NHIS member, there should be some form of biometric verification. Odi will finger bet to bibisu and I best scan your face, so that when I sit in my office, I can look at the file from Confanochi and tell that whatever they send me, it should not exceed a particular number.
A number.
We'll be 20 years next year. All our life, we have paid in the dark.
But I don't know that payment in the dark, no, a business way you may be no.
Obi,
if you want to implement such a policy, invariably, there will be resistance. More prepared for Sadia.
Obi, now, kasai se minim se obi anu aduane. Una wo kan Obi. Enti Sankamadru one amehwe measures are me be dealing with. But let me quickly say Obi, your code be a friend *929#.
Yes.
Apart from using it for renewal, so be renew check your active status. Etimisu eboye maye the friend by how do you call it, non-biometric verification.
Okay.
Just say Obiko Hospital. Now you're taking the details. Your service for health insurance we introduced 2018.
Okay.
When this *929 came.
Okay.
Obi, Okoe Hospital. It means send you text message on your phone. HSA what balekma na yampa na confirming. Some of them, yet me free back from health insurance.
Okay.
Those people now be some say your message where system say Okoe lekma yampa na. So to make us say Obi to be catch so me for lekma for the past 20 years. And as we speak, we have evidence HSA there are more practices in the system. But you don't want the malpractice to happen. Na Okoye audit trail. Now what happens is the biometric verification will make sure will
stop the malpractice from happening.
Absolutely. And one key legacy President Kufuor Achaje. Now you know what? Dr. Biometric Ghana card and Kufuor said, na card back. I say solve problem. I call you magic one. Mo sure ni ma. Onim say because you connected to Ghana card. Yahoo demonstration actually say ultimate visit hospital. Who do start me two machines? Even without knowing Sebi having your card. It's me pulling within but say Okoe Boye na wabe appear or lekmano. Solution where existing in Ghana here.
Oh, okay.
I demonstrate chair me. So we have the solution. What we need is the willpower and the cooperation to make sure say this will happen. Obi. Now, my catch most of the providers say, me tako financer. I send bank sometimes. Me of a ken. Or doing boko waka say doctor, they be also ma uska baby. Now skana utiano, only be a
sikana
echo. Now my catch say uncle. Seven baby and quarry we party I'm in the dark. From President Kufuor's time to now. So Obi, a serious programmer by the grace of God. Once we do that, a bit more efficiency is solid. Now we can make savings. A bit more you are adding more packages to the scheme. So what is the childhood cancers? I can't.
Yeah, I think I heard the Vice President talk about that some time ago.
You can say, ma yen train manipa en free and sana ya kana say Obi ebe me ya say ebe ka Ekufuor asem ebia one day when only wiase Obi ube jedi say from independence to now akwaranya cancer and we have I think an average about 500 plus kids
with cancer
they are every quarter they record new cases. So let's say globally annually you are dealing with let's say about 2,000 cases.
Okay.
Obi ube jedi say akwaranya cancer or Ghana from independence to now. I was saying the parents now na enyi omubotom ska entua. Now mama ya poorly tariffs. Our health insurance is paying now for them since July. Obi when you don't know where service tariff. Say wa call Kolibo Asheno.
Okay. Asempa
Obi
FM 94.7.
Akwara wa call the hospital for cancer. In fact, the figures are very astounding. Chemotherapy tariff near 188 Ghana cedis per patient.
Wow.
Now, when you say malaria in Yamana, I have to get the exact figure. They are in a single digit. Maybe a charge, maybe a 50 Ghana 70, 188. Now, but could the retinoblastoma, cancer of the retina in kids, 1,126 Ghana cedis
Per patient.
per patient.
One visit.
One visit. Now, visits in Ukraine is in cycles. When you are treating a child, there are many stages. You have induction stage, you have maintenance, you have delayed maintenance. Sometimes it takes more than 6 months, 1 year. Now, Obi, where services in Dronum by in Dronum so make it a list, some cost as much as 1,000 Ghana cedis. No wonder for many years the actuarial scientists said, be careful. But this regime, President Kufuor said, why are you paying the child for the child with malaria? And you want to close your eyes to the child
with cancer.
Now, Sebi, but I am happy to say that today as we speak, Tamale Teaching Hospital, Confanoche Teaching Hospital, in Kolebu, Rich Hospital, I think a Fia Quanta, Cape Coast, when kids now go for treatment
on cancer, health insurance
Afauka. Now, the good thing about childhood cancer say 80% of the cancers can be treated completely, cured, unlike adult cancers when you start early.
Okay.
Now, where the mami born me mami abaso, Mrs. Rebecca Kufuor. Say parents your mumba call for treatment and yet treatment I sure one day now a coffee. Sometimes the child for one cycle must stay around for a week or two. Obi, one of the biggest problems apparently also was accommodation. Now akwara ni mami thousands for drugs. Usi onko dani now from pocket. And the parents ni bebre after 1 or 2 visits now omajai. Parents are mumba what childhood cancers omo society. Omo kache mi so omo chingana nyina looking for help to build some shed for mothers. Omo so omo chizana omo bre. Eno obi kache omo so Mrs. Rebecca Kufuor health related issues e odi na won di shame. Enti onko hunu. Obi from 2017 up to 2019. Onu say Mrs. Rebecca Kufuor so onu so e mame. All sebi ska kra onya either from family friends bibia e beba no ho ana sebi otimi nikasa na ye de no jiwo president ankasa ho a ni nyina na eko into building a hostel for cancer kids and their parents.
Ewo Kolebu.
54-bed facility with a playing area, learning rooms, washrooms, everything. Nyamia Dome, just I think a year or two ago, and I commissioned with Kolebu. Built not with companies, where Scar, I said, Onya Bibi Kakra, now the tomb. Now I like what the president of the cancer parents, they actually lost hope because Uchinya Obianya ready. Now because they have a place to sleep and health insurance is paying for the care, Obi. Now they also matter in this country. Now I'm happy to say, as we speak, within the last 3 years, say family planning services in so Abanwe Afawonka.
Family planning.
Yes.
As part of NHIS.
Yes. Obi from 57. When Biometric says for the first time in this country, Obi say first time can't do, but it's true. From Nkrumah to now, if you have family planner, you pay for the consultation. Nobody covers it. I have the rates here, Obi, for services. Insertion of IUD. IUD, intrauterine device. The fee is 8 Ghana cedis. Insurance we pay.
Okay.
In fact, removal of IUD. Konako year. Anka, and yet this era, you have to pay 11 Ghana cedis at whichever facility. No la general no. Omobade biya obeya otia. Now you can go and remove it. Insurance will pay. It's 11 cedis. I have the tariffs we are paying here. Obi. So the point now, in fact, vasectomy. Obi. So when vasectomy. I don't know make a vasectomy. We munano. Obi. Vasectomy. You say Bema. Say what do you want? Ah, more be amba 5, 6. Ah, person will be your operation. Yet me chichi. Will spend that. It be expensive for no. Now, yes, ebe chichi. Enti ebe show no ye chichi a. Odi oba nya bibi yakra na nsi oba expense ni mu. Enti why sterile oba no obi a onyim obi a biom. Obi vasectomy
and
ni bono
a permanent at the
permanent.
vasectomy.
But say Mr. T law kakra no. You better you say permanent but largely. Because nipa ofie sebi se ofie dia 1 in 10,000 occasions one share na akwaraba. But the point is that it's a permanent one.
Permanent. Okay.
Now vasectomy na cost 101 Ghana cedis. That's what health insurance pays. We be man na otie me na o pese wa wo dodo na o pese o njai wo a vasectomy health insurance is paid for that. Obi tubal ligation oba o pese yen chichiri ebi a okosua no fa no so that onwu bioma health insurance o cost for insurance you have 101 cedis for the procedure. Only insurance there Obi say me can say 8 Ghana where one visit one procedure. Only insurance obetua card ebi 20 cedis. Obetua consultation. Obetua ebi going to lie in the hospital. Obetua procedure no one tua ebi 1,500 say o ko chichi wa wodie. O card na nyina insurance fa. Na Obi beyond this no uti hydroxyurea. A drawer eboa pa omo sickle cell. Obi is one of the most powerful innovations in drawer yatima innovating ama won. Udomu 2 hydroxyurea so a boama the level of crisis a omunya no esote emomunya good quality of life. Now we are say way enye say uti keke o we have what to call quality adjusted life years. Na uti na de bia oyaw na sickle cell for omunya vaso occlusive crisis. Na onyo ya Obi enu pe na ya emu ya dincha wo. Wow, it's not easy. Who are done for now ebusani awanya oye sikla. It's not easy, but the hard work cooperation of citizens and by the hand of this government. Now all sickle cell patients can have access to hydroxyurea. Is being paid by the national insurance. Absolutely. And Obi, a lot of things are going on. Middle Kasai must sign document with the blessing of the president. First, no, we are 70 years and above. Ube uko insurance and ne. Now one year emergency, now about hospital, now insurance. It takes you 1 month as an juma. The waiting period is to discourage people from coming in only when they have a problem. But President the trans say, Obi awanya 70 year kodi. Obi, say who discouraging you through some delay for 30 days. No, I know yes. And I'll thank one gentleman, a citizen. I'm saying this to show, say, everybody's mind counts. One citizen throw me letter, and a man call your board, minister ho, Ajimamenu, and a chief of staff, ultimately president. Say we have to look at this. One citizen throw me say, "Oh no, we're forming NGO. Oh no, the Osha and paying for. And also Baku, Eko Hospital. I'm all your card man. Omukacha say, I was there 30 days until a year juma. No, that waiting period. What he say? We have lifted it for pregnant women and children 5 years and below. So he thinks that 70 years and above should also enjoy. Obi, where the who say nipa no ye obi obe so wa no litigant pa. Obi. Na me hwe di no anye me wa. We share chrome of free na. Omo ye serious litigants. Na say na wo hwe me no. Say bia me dru nyame ma me nyansa me ntimi nka e bia free na e dey asema ba.
Me minim that ntimi mu.
Correct, Obi. Enti based on that no, we have signed the executive document approved by the board and the ministry. I'm sure from in the next days, all senior citizens in this country, 70 years and above, any day they register for insurance, it is active on the same day.
Oh, or register, yeah.
Is to give them complete cover and prompt cover as well. Unya 70 dia, but modern, now sure say you check your status. Obi, we'll get there. In Ghana now, December is the active month. That's how we are going to call December now. If you are Ghanaian, not December drew, now constant and check whether you are active or not, then you are in big problem.
Yeah.
And this is something that Obi who minim Obusian for bebre say be asem to my befreo. So it's not only about you.
Yeah.
Make sure all your loved ones
register
are active on insurance. In December, you have to call everyone you love and ask. Maybe say lalas. Dominic catch me say, "Oh, who ni ye? Enti mi share so kita insurance card na." Obi, say na lalas or correct.
Oh, okay, Okrebi.
ni active no kura no anu ye hyeche me de no Dominic de ma ho ni card o say mu private cover the whole of multimedia e ho na
ba me your private cover ba me sign wo health insurance
na
card
so why Pentecost elder de mu di share so finchem obi enti there's a lot happening at the authority na de meka maybe say if you have any when say obi ye per se national health insurance scheme the authority and yet the most visible and most relevant public organization in this country.
The most visible
and the most
relevant
yes.
public organization.
Absolutely.
That's a huge objective.
Me catch obi say me say VR1 and your voter regional visibility relevance. Why are we going to relevant? Relevant because if every Ghanaian ensures that they are active on health insurance, it means that your relevance has been established. Which means someone say I know never buying. And like I've told you, and yet a Bonington and Crawford insurance, either nobody has told them through like we are doing this conversation, or they've not experienced the realities of life. Like the gentleman who went to Winneba trauma. Obi. Me catch any say insurance no. Now person yes some way. And I say now I say ba o be iska. Me na me iska. Me so be align e your card no Obi, it's because me I've lived health insurance at Chebi. Oh doctor, you ain't a lawyer so. Doctor Penna, show be na unim dia no niska. Sometimes you want to give money.
Yeah.
Because I know you are suffering from acute appendicitis. Me nim say me bio ye ma metima fix problem no. But here you are also on insurance niska. Sometimes I'll pay. Because Obi, me nim say in 3 days, if you don't get the money, you will die.
You die.
And Okoe Boye me nim say me spare 500 from my salary, I will save you.
Yeah.
And to me no obi amesiano before I came to health insurance. First time I said, do you have insurance? Because I've seen it several times. Procedures are another thing in Crawford intimintia. And obi, sir, politicians here obi here power yet me cancel. Obi wa here kasa on insurance because you see and cover and fa. Who told you?
But are you by this then saying, sir, Omonswa genuinely or facilities nibia would say there is clear discrimination of insurance for claims payment mantem into mumu jraha yenhwe mumu amuska mubetua momra? Are these not real?
Obi, because I don't want to be a theoretical leader. Anything on me from 2009 I started practicing. All the time I go to private public hospitals to consult. Lekma, I'm not on payroll. I go there not because I want Sebi coins. I want to live what is happening on the ground. Uber Lekma, there is no separate queue for those with health insurance and those without it. And then I say, be careful with what politicians say. It is true. There are occasions in the past, Uber will be a 1 year into facilities. Hospital now 1 year health insurance in Tiano. Ebi a Sebi paracetamol on stock here. Obesho, Bosi Koto Abonti. We've had challenges as a scheme. But the point I'm making is say, Obi, just 2 weeks ago, me share hypertensive in drawing Yadimano. As we speak, remember our payments. The last payment I'm sure Obi or Omomutie providers no. Some got text messages just this afternoon. We've paid for December 2021. December
2021.
Now, the scheme runs on a credit basis. Ushenipano and Sana Chodi Abraham scheme netia. On the average, we give about 30 days for providers to bring the claims. Yensu Sebi, yeah, Bogana for who bindy. And say to Yanni Ghana for scan. Averagely, we are supposed to take about maybe 40 days to 60. The whole process, not just the vetting, from the time we receive
claims, no,
to
time I'm to
time I hit on account
40 to 60 days.
Yes. Now, Obi, when you put the two together, you are talking about a period of about 3 months.
3 months.
Period. So when you look strictly from January to Ene, there are about 8 months in this year. When you take out the 3 months, how many are you left with?
I got 5 months.
So strictly speaking, we are owing the facilities about 5 months deficit or lag. But what I say, if you add all the 8, obviously, oh no, I'm going to 8 months. With all due respect, ABI, you have not gotten the concept. We don't pay on the day they take care of them. Even the facilities, some of them, sometimes it takes them 2 months and buy. Now with this 100% digital, uploading electronically,
Claims,
it will cut down the time sometimes to about 2 weeks. It can also cut our time instead of 2 months to 1 month. So you are looking at the whole process being reduced now to about 5 weeks, 5 weeks.
But the question now then will be, sir, I didn't know since December, because I know, sir, and we trade more eloquently, sir, scheme, no, and I said National Health Insurance Authority, the act setting it up, no matter you manage the scheme.
Yeah.
And there is an NHIS fund.
Yes.
And most times the authority are more regulated space, you know.
Yeah.
And meaning say fund, you know, sources of money into the fund, you know. There is a tax handle like that.
Absolutely.
As it can be direct.
Yeah.
How is it possible, say, the last claims I will try in December 2021?
Obi, me mpese meye comparison of now and then, but 2016 before I hear bar NPP abide by now if you add, you subtract even a 3 months waiting time. Now facilities were owed an average of 12 months. Now we have cut it down to about 5-6 months. Makawe Bia said, my target is to do 2 months. Maximum 60 days in terms of my lag. But Obi, it is true, say, Yesika Nina Eba Futonum, as we speak, from President Kufuor's time up to a ne. Obi, and yet Nina na ya edimaye. But what I say? That is a challenge. But Obi, guess what? I tell everybody, say, the biggest problem that the Ghanaian faces today is not the fact that, Sebi, we don't receive all that is due us at health insurance. The biggest problem is that half of Ghanaians don't have any form of medical insurance. You know what I'm saying? So, despite these challenges, waiting time, because most facilities are alert on their phones. You know, anything I me call mami no ba alert manu yeshwe no. I can tell you on authority, almost all facilities, even private, are NHIS for. They are taking care of them because they know that we are working hard to close the gap.
To close the gap.
So although a challenge exists with all the releases come to us, by the grace of God, with efficient management, you know, the facilities are still taking care of our clients.
Is that not? Is it not because they will take care of your client because they find ways of getting money? Because Obi, for example, say Obi, docs should visit the facilities, especially in Accra. People with NHIS still pay huge monies. I can come with receipts to your show. Good. George Michael. In Obi say, you know, would listening to you will go like, okay, maybe facility in share me. But I'm not finding way of taking money from
Obi, charges are you charge health insurance clients. Yes. I want listeners to listen to this carefully.
Okay.
Asempa FM.
President Ankasa, His Excellency Akufo-Addo, and a cabinet, sending me message said, Doc, it is a fact that at certain facilities, people are charged monies, even when they have insurance.
Yes.
But I'll make this statement before I go into how we are addressing it. If you're a Ghanaian, you are way better off with a health insurance card or cover that still at certain places makes you pay some monies than walking around without anything at all. Obi, it's a profound statement because I've experienced it. Obi call hospitals, they say, now you call Gina War or call cesarean section. Now on need any form of insurance. And now let's say fibroid, Moja 2, now you call your operation, no insurance. Obi free reach hospital, Abano, 1 to Accra, 5,000 Ghana cedis.
Yeah.
Oh, insurance, what by report your money about illegal charges, and 1,000 Ghana cedis. So Okoe Boye is saying that you are safer in this country with health insurance cover, despite some of the challenges of extortion. Now, let me come to the extortion bit. There are two main factors accounting for extortion in Ghana from NHIS clients. One, and he say, tariffs are now 30, sky for services and the drugs, now, baby, are unrealistic. The law at 852 say every year, together with the providers, we should review the tariffs. Until just 1st July, you're publishing new tariffs. In some cases, they were 400% the old price of woman. Until 1st July, for close to 2.5 years, now you tariffs review.
And where your tariff and on a certain the cost at which you pay to facilities.
Exactly.
Okay.
And you're sure for ABA, I'm sure for ABA, urinary tract infection. Ebia yaka say we pay the facility 50 Ghana for taking care of urinary infection. That's the service. And we pay 50 Ghana for drugs, antibiotics. Ebia mama will see pro drugs. Me wa obeko market no. Cipro no hospital nankasa time I was talking maybe oton 70 Ghana. And to hospital no nim say oton antibiotics no ma wa obeboka. And to uba wan sho obeka tell say cross the street no na ekotobi. Enti